My name is Bryce. I'm going to be your nurse today, Jessica. I'm going to start by raising the bed to working height, which looks good for me. I'm going to ask her questions to make sure she's oriented. So I'm going to ask her like her name, what day it is, what month, what year, why she's here, where she's at. And then I'm going to further look into the more focused assessment part. She's got admitted for back pain. She's probably been laying here for a while. I'm going to ask her about her pain level before I get started doing all this. She said roughly it's probably going to be an 8 or 10. She's in back pain, and I imagine it hurts pretty bad. So after that, I'm going to check her vitals right away. Woohoo. And then it's about 94. I'm gonna then go into getting her pulse ox and get the reading off of that. And then for her O2 stat, and then I'm gonna check her temperature. I would start by checking the temperature, and then during that time, I would let her know everything I'm doing. I'd verbalize everything. I'm gonna check her pulse, temperature, blood pressure. I'm gonna do the blood pressure now. I got 154/84. I'm then going to further move from the head to the toe, as which the assessment is. And I'm going to check her lung sounds. And then in certain situations, I'm going to pull this up, and I would notify her that I'm going to do this for a clearer, better understand, so I can hear better. I would have a towel or a privacy blanket to cover her up, which we do not have right now. Okay. From there, I'm going to check her apical pulse. It is the 5th intercostal space, mid-clavicular line on the left clavicle. It's right about the nipple area. You would do that for a minute, and it was about 94 as well. And then going to check her both pulses in the hands, and they both feel normal. They correlate, they're set. So I'm going to check for perfusion in the hands. You do it about 2 or 3 times. Make sure the blood, this is when just like capillary refill, and the color comes back, and it's just showing that it is getting blood to that area very well. And I'm going to do, I'm still in the upper body, so I'm gonna have her do a range of motion with her hands, head, all that fun stuff. And then I'm gonna do her GI area now. I'm gonna check all 4 regions of the large intestine. They all sounded active. You would listen for about a minute on each one to listen for about 5 gurgles. Throughout the whole assessment, I was checking the skin as I was moving down from the head to the toe. I would, so with the orders state that, like always, you need to get your vital signs every 4. Doctors usually put those orders in, and then they can prolong them to like 8 hours, every 8 if they're here for a long time and they've been looking good. You would check INO always. I mean, that's just a given, the INO. And then this order here says that we need to insert an indwelling catheter. So I would be talking to her throughout this assessment and talking her through that while I'm doing the assessment. Like that would have been a good thing to count respirations. You know, I'd be talking about an indwelling catheter, ask her if she has had one before, questions like that as I'm counting. So after the assessment, I would do that. I would, she has a nasal cannula at 2 liters per minute. We would make sure that that is set correctly in her nose correctly, and check the wall to make sure it is up to 2 liters per minute. So with her pain, I would then, after the assessment is all said and done, I'm gonna go through the legs. I'm gonna check for pedal pulses as we move down the legs. As we move down the legs, I'm checking the skin. Obviously, she has an injury on her leg here, so I would ask her what's going on, and if this has not been charted, I would look into it and make an assessment and chart on that. I would chart like what it is. It could be a pressure injury on her back here on her heel Achilles area. It could be that she sprained her ankle. I would ask and I would clarify that with her, and we would consult the pain provider and the provider itself and make sure to document this. And I would check for pedal pulses, so I would take this off and I'd do this on both legs, check for the pedal pulse and make sure they're both there and strong and palpable. As I go down the legs, I would check for skin, any ulcers, any pressure injuries. I would have the patient turn and I would check her bottom. You always want to do that because a lot of these people are laying in bed majority of the time. I would have her lean forward, I'd check her back, make sure it's good, and then I would address the pain either before or after. Some patients are okay with you just quickly doing the assessment and then we'll deal with the pain. So now I would go back, look at the order. I would make sure that these meds match up with my patient and they match everything. They have the name, the provider, they match the provider's orders. And she said that her pain was an 8 or a 10, somewhere in there. So more than likely that would surpass the Norco, and we would probably end up going to like a Dilaudid here, IV push. So with that, obviously she has an IV then, so we would check the IV, which it's not on here, but she would have an IV if they have medicine for an IV push, and if she doesn't, I would give an IV. I read through the orders earlier that she has an allergy to morphine and penicillin, so I would make sure these medications do not disrupt her allergies and cause a reaction. I would allow for the fact that she's in pain, and I'm going to give her time before I bug her again. I'm going to come back, give the Dilaudid, and then I will come recheck her in 30 to 60 minutes. She has an MRI of her lumbar spine with contrast later, so I would prepare her for that and notify her that she will be getting this and make sure she knows what she's doing, what's going on, and what will happen during that scenario. And after that, I'd say we are probably pretty good to go. Everything looked great. I'd started with the facial features, from my hands to her hair, everything was great. Jessica's gonna be great today.